Hello, my name is Gayle Palmer and I'm the registered osteopath at the Living Elements Clinic. And today's little podcast is all about builders and bricklayers. Now, I have had over 30 years in practice, and in that time, goodness me, I have seen lots and lots of injuries and damage and wear and tear with that particular group of clients. Why? Because they are doing lots of heavy lifting, heavy work for long periods of time, not necessarily paying attention to what they should be paying attention to themselves or the position in which they're working. So I'm going to just kind of illustrate some of the things that bricklayers and general builders in particular struggle with. And hopefully that will have you understand where osteopathy can make a difference, and also some of the things that you can do at home. So first things first, kind of obvious really, you tend to be one of the groups who do a lot of heavy lifting. So bricks obviously are particularly heavy, or blocks, and especially so if you're under DPC level. Because you're always bending down, and the blocks, as you know, are ridiculously heavy. I can't lift them up with my hand. I've only got little diddy hands, so that doesn't help. You also tend to do a lot of kneeling with or without knee pads in. Thankfully, nowadays trousers, work trousers, have knee pads already built into, or knee pad pockets already built into the trousers. And that has saved masses and masses of my clients struggling with earlier osteoarthritis in their knees than they perhaps would have done, but it's still a really big issue. You also tend to be one of the groups that does a particularly large amount of persistent, consistent bending over and twisting. So whether you're a ground worker and you're digging out soil or what have you, that you put your spade in and you throw it over to one side or the other, and that's fine if you're just doing it for 20 minutes, half an hour, but you don't do it for 20 minutes, half an hour. You do it for hours on end, get through several tons. I know, I have done it myself, but I'm not doing it each and every day, so I've got a chance to rest and recuperate in between and have plenty of breaks in between. I'm not on a job price, so that's a big issue. Dehydration. If you are not drinking enough fluids, particularly water, to stay hydrated, all of your tissues start drying up. You know when you have a lemon and you have that feeling as the acid attacks your tissues, your cells? That's exactly what happens throughout your body if you're not drinking enough water. You need to be drinking 2, 3, 4 litres possibly a day as a particularly active builder, plasterer, bricky, because you're huffing and puffing a lot and you're breathing out a lot of water vapour at the same time as sweating as well. When you're drinking that much volume of water, in order to pass it out through your kidneys, you also need to have tissue salts, sodium, potassium, sometimes magnesium, etc., in order for the chemicals to take the water, abstract the water out from your blood vessels and put it into your kidney system and then down through your bladder and out. So if you don't have enough minerals in your system or in your blood, your body will abstract the bone density, literally the magnesium, the calcium, etc., from your bones and other organs in order to get rid of that water. So that's a really important thing to bear in mind, because if you're short of magnesium, you'll get lots of muscle cramps, particularly at night, restless legs, you won't be able to concentrate, and your bone density will go down, particularly if you're short of magnesium, because you need magnesium to take up calcium to put into your bones. The other thing that I see so frequently is the bare back syndrome, the builder's bum. When it's cold and you're bending over a lot, your shirt, jumper rides up and there's the obvious result. Now, that means that your low back muscles are continually getting cooled, even though they're working. Although that might feel quite nice if you're working especially hard because it's a way of taking the heat out, for your low back muscles, that's a disaster. So making sure that your back is covered, get extra long shirts, pull your trousers up over your butt and over your back. If that means you need to have braces, put some braces on. This is not a great time to try and look incredibly trendy. Frankly, if there's any women around, we're not that interested in builders' bums. It's just not that attractive. But it is an issue for you personally and how much you can and can't do. The other thing to do that will really help to support your back if you're doing a lot of heavy lifting or lifting and twisting is to have a back brace, back support, or a belt, like a big fat weightlifter's belt. So that supports around your low back. And the reason for that is you can push with your abdominal muscles onto the belt, and that helps to create a rigid container for your abdomen to protect your back and your spinal muscles themselves. So go and get yourself a decent belt. In the winter, I highly recommend a neoprene stretchy belt because it really keeps you warm as well. Obviously, when it's really hot in the summer, that's not quite so comfortable to live with, to be fair. You'll probably overheat to start with. And then the other thing that really tends to wear out with builders and brickies, you end up with lots of tennis elbow problems, shoulder problems, and neck, particularly if you're doing lots of looking up, you know, if you're tapping in fastenings or, you know, moving planks around and what have you, and lifting them up and watching what you're doing, and anything working at height, you're always looking up. And that puts a lot of wear and strain on your front neck muscles, but also on your spine, and a lot more arthritis, which can lead to nerve impingements, which will give you pins and needles numbness down into your arms quite frequently. Can also have an effect on the nerve supply to your heart and your lungs. So it's something to be taken really seriously. Good news is osteopathy is fabulous at helping to resolve a lot of those issues and get you back in alignment, but in working with you to help you find ways to do the tasks that you need to do in a more efficient way, ergonomic manner. Other things that you can do include having plenty of oily fish, take fish oil supplements. Please get really high quality ones. I use only Neolife Salmon Oil Plus supplements here in the clinic because they have absolutely no contaminants in them. Absolutely no contaminants, 160 contaminants they check for, zero tolerance, because I personally don't want to end up poisoning my clients. Most fish oil supplements, cod liver oil, etc., are absolutely filled with heavy metals residues because the fish concentrates those because they are toxic in their livers. Lots of oil in the livers for good reason, because it's a way of keeping the contaminants out of the body. The body puts it into the oil. But of course, when you then abstract the oil, it concentrates all of those and you're there ingesting them. Don't think that's very clever. So if you want to have some really awesome supplements, then come and speak to me at the clinic. But do wear knee pads all the time, even if you don't think you're going to be doing much kneeling, because it will absolutely save your knees from a lot of osteoarthritis. Do wear a back brace. And if you need to have some advice about that, then come and speak to me. The other things that are very common with builders and brickies are disc injuries, because you're doing so much bending and twisting, you know, years and years and years of it. And we can definitely help with a lot of that. Sometimes it does need to have surgery if you end up with too much back pain or sciatica and nerve impingements, which are excruciating, because I know that you'll be wanting to get back to work as soon as possible. That's my aim too. And so you often don't have enough time off to recuperate before you go back to work, before the rest of the healing is properly completed. So that's an issue that you need to think about, and we can work on together. And the other common injury is traumatic injury. Falls, particularly from height, ladders, scaffolds, what have you. Doesn't have to be that high though. A couple of inches off the ground, foot, 2 foot. Doesn't have to be high to cause a big problem. Obviously, falling from a story or two, that can cause major issues. Again, whiplash injuries you can sustain, and those are very effectively treated with osteopathy. Concussions, it's easy to get concussed with or without a helmet on, to be fair. We've all done that. Walked into a scaffold pole or whatever else. And then there's the odd injuries, you know, nails through boots and what have you. Tends not to be part of my scenario for treating, but it does happen because the immune system then goes on overdrive. It's got an infective agent there. If that doesn't get fully resolved, osteopathy is amazing at sorting that out. Antibiotics usually at that point won't make any further difference. It's a lymphatic issue and a drainage blood supply issue. So if you've got any questions, or you know someone who is struggling with the physicality of being a builder or a bricklayer or a hod carrier, then come and see me at the Living Elements Clinic in Siddlesham near Chichester, and we will do our level best to get you back to work as soon as possible without causing more problems for you going forward as well, and help to teach you what you can do to help yourself. So the link will be below. If you've got questions, then just ask. You can find me on LinkedIn, you can find me on Facebook, Living Elements Clinic. And my name is Gayle Palmer, and I look forward to being of service. Take care. Bye bye.